Azithromycin is available in 250 and 500 mg tablets and is a macrolide-type antibiotic. What is azithromycin and what is it used for? Azithromycin is used to treat a wide variety of bacterial infections. It works by stopping the growth of bacteria. It's widely used to treat chest infections such as pneumonia, infections of the nose and throat such as sinus infection, skin infections, Lyme disease, and some sexually transmitted infections. Azithromycin is used in children, often to treat ear infections or chest infections. This medication will not work for viral infections. Things to know before using azithromycin include: before taking azithromycin, tell your doctor or pharmacist if you are allergic to it, or to other antibiotics, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of liver disease, kidney disease, a certain muscle disease. Azithromycin may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Before using azithromycin, tell your doctor or pharmacist of all the drugs you take and if you have any of the following conditions: certain heart problems, family history of certain heart problems. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. This risk may increase if you use certain drugs or if you have conditions such as severe sweating, diarrhea, or vomiting. Talk to your doctor about using azithromycin safely. Azithromycin may cause live bacterial vaccines to not work as well. Do not have any immunizations vaccinations while using this medication unless your doctor tells you to. Before having surgery, tell your doctor or dentist about all the products you use. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This drug passes into breast milk. Consult your doctor before breastfeeding. How is azithromycin used? Azithromycin is usually taken once a day, unless you're having it by injection. Try to take your medicine at the same time each day. The usual dose is 500 mg a day for 3 to 10 days depending on the infection being treated. For some infections, you'll be given a one-off higher dose of 1 gram or 2 grams. The dose may be lower for children or if you have liver or kidney problems. Azithromycin is sometimes prescribed long-term to prevent chest infections if you keep getting them. In this case, it's usually taken 3 times a week, often on a Monday, Wednesday and Friday. Swallow tablets and capsules whole with a glass of water. Azithromycin liquid is available for children and people who find it difficult to swallow tablets. Carry on taking this medicine until the course is completed, even if you feel better. If you stop your treatment early, your infection could come back. The liquid can have a bitter aftertaste, so it can be a good idea to offer children a drink of fruit juice afterwards. If you forget to take a dose, take it as soon as you remember, unless it's nearly time for your next one. In this case, just leave out the missed dose and take your next dose as normal. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten one. Taking an extra dose of azithromycin by accident is unlikely to harm you or your child. It may, however, increase the chance of temporary side effects, such as feeling or being sick or diarrhea. Talk to your pharmacist or doctor if you're worried, or if you or your child accidentally take more than one extra dose. What are the side effects of azithromycin? Feeling sick, diarrhea or being sick. Losing your appetite, headaches. Feeling dizzy or tired, changes to your sense of taste. Serious side effects are rare and happen in less than 1 in 1,000 people. Call a doctor straight away if you get chest pains or a faster or irregular heartbeat. Yellow skin or the whites of your eyes turn yellow, or pale poo with dark pee. These can be signs of liver or gallbladder problems. Ringing in your ears, temporary hearing loss, or you feel unsteady on your feet. Severe pain in your stomach or back. These can be warning signs of inflammation of the pancreas. Diarrhea that contains blood or mucus. If you have severe diarrhea without blood or mucus for more than 4 days, you should also speak to a doctor. The information you listen to in this video is taken from the package insert of the drug. If the video was useful for you, please like the video and subscribe to the channel for support. I wish you healthy days.